Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Dr. Arif Ali of Peeples Cancer Institute in Dalton. Thank you so much for joining us today, Dr. Ali.
Yeah, thanks for having me. Excited to talk about what we do over at Peeples Cancer Institute.
Well, it's an exciting place, and I can't wait to get into that. I want to introduce you to everyone. Dr. Ali is a board-certified radiation oncologist. Peeples Cancer Institute, located at 1215 Memorial Drive on the campus of Hamilton Medical Center in Dalton, Georgia. Today, one of the things that I want to talk about, Dr. Ali, is thyroid cancers. Now, thyroid cancer is something we all need to be aware of. And how is that treated? How do you treat thyroid cancer?
Yeah, so thyroid cancer is perhaps something that not a lot of folks really think about, but is certainly it's not one of the most common cancers out there, but it's also not rare either, though. You know, as with any cancer, you know, there's quite a few varieties of thyroid cancer, quite a few varieties of treatment. But I'll talk about just in general the the treatments for your run of the mill, what we call functional thyroid cancer. Typically, these will present with a nodule within the thyroid. A patient might feel a nodule themselves, and they might visit their doctor, and their doctor might be like, "Hey, your thyroid's a little bit big," or "Hey, the right side's a little bit bigger than the left."
Now, thyroid, that's in front of your throat.
Yep, exactly.
And it's shaped like a butterfly.
You got it. That's exactly right. And so, for whatever reason, there may be some concern. Their patient may have some other sorts of symptoms that prompt further investigation of the thyroid. But once there's a concern, there's things that can be done like ultrasounds to investigate the thyroid, to look for nodules. If there's some concerning nodules, those can be biopsied, and we can look at it under a microscope to make a diagnosis of cancer.
Well, that's a very good explanation. What about treatment for thyroid cancer?
Yeah, so treatment for thyroid, again, can be, there's different options available depending on the stage of it, depending on the type of thyroid cancer, but usually there will be some sort of surgical resection of the thyroid. For some types of thyroid cancers, that may be it. You just have a part of your thyroid taken out, maybe the whole thyroid taken out, and that's it. Occasionally, we have to do some additional treatment for thyroid cancer, something called radioactive iodine treatment, which would occur, after surgery. And radioactive iodine treatment is an interesting sort of treatment.
Yeah, what is that?
So, thyroid tissue uses the element iodine as part of its process to produce these various hormones. And so, iodine's found in quite a few things, and salt, for instance, it has iodine in it, and so the thyroid tissue readily takes up any iodine that's introduced into the body. Now, most iodine is not radioactive, and so what we do is we make iodine radioactive. And we know, and there are some types of thyroid cancer that take up iodine, just like normal thyroid tissue takes up iodine. And so after a thyroid is removed, there may be some random cells left within the neck. And so we can use radioactive iodine to selectively kill off any of those remaining cells. And the way that it works is it's just a simple pill. We just give the patient a simple pill. They swallow it. It's not even a large pill, but they swallow it, and it has radioactive iodine in it. Initially, the iodine goes everywhere, but then it very, very quickly collects within thyroid tissue or thyroid cancer tissue. And so this is like a heat-sinking missile, if you will. It's initially going to go everywhere, but it is eventually going to focus in right on that thyroid cancer. And we give patients enough dose to kind of kill off any random cells that may be in their neck or elsewhere in their body.
Is this a one-time thing, or they may have to go back and get 2 or 3 of these treatments?
It's designed to be a one-time treatment, so just a single pill, and then we might do some imaging, a week later, just to kind of see where the iodine went. But the idea is that we give enough iodine to kill off any remaining thyroid cancer, again, for certain types of thyroid cancer, and any residual normal thyroid tissue.
Now, when we talk about surgery for your thyroid, what are some of the side effects?
Yeah, so when you have, the surgery itself, is fairly straightforward. We have ENT surgeons in the area that are excellent at what they do, and they're able to kind of remove the thyroid tissue, and for the most part, there's very few, if any, side effects from the surgery. But it's surgery, and so there's some recovery. Now, once a patient has their thyroid taken out, they're not producing, they don't have a thyroid to produce those hormones that are typically produced by the thyroid. And so, we would need to provide supplemental hormones to make up for that, something called Synthroid or other sorts of medications. And so we have an endocrinologist at Hamilton Medical Center that is able to manage patients and provide all the supplemental hormones that they need. And then we, of course, have radiation oncology where we can provide the radioactive iodine. And so really at PCI, we have a full complement of resources necessary to manage the treatment of the thyroid cancer as well as manage the patient after that thyroid has been removed for the rest of their lives.
Peeples Cancer Institute in Dalton, Georgia. Tell me about clinical trials.
Yeah, so this is clinical trials are very important to medicine. So the way that we evaluate if a given treatment is going to be effective, if it's going to work, or the way that we evaluate side effects is we have to perform clinical trials. And so these are very structured processes and procedures in which a patient will receive various treatments. Occasionally there's randomizations, but they're important to do because that's how we learn what works. And so the way that clinical trials are typically performed is we sort of have a standard of care, and then we might have an experimental therapy of sorts. It can be an experimental chemotherapy, it can be experimental immunotherapy, it can be experimental type of radiation. But there's always an experimental component. Now the advantage to patients is that they're able to receive the forefront of technology. Really the latest sorts of medical technology and treatments are in these clinical trials. And sometimes the only way patients can get access to these sort of experimental treatments is through a clinical trial.
Wow, at Peeples Cancer Institute.
That's right.
Dr. Ali, before you go, I want to talk about screening for thyroid cancer and also any stats you have on thyroid cancer before you get out of here.
Yeah, so the screening for thyroid cancer is generally performed just by primary care physicians as part of their, an annual physical. So I would certainly encourage everyone to visit your primary care doc at least every year. And as part of that, they'll probably check the thyroid. They'll look for nodules, look for any asymmetry. And that's typically the way that these sorts of cancers are picked up. Thyroid cancer, it does affect, quite a few people. Right now, there's about 52,000 people in the U.S. that estimated to be diagnosed with thyroid cancer. Fortunately, the survival rate for this cancer is pretty good. So the five-year survival rate's about 98%. That is assuming, however, that it is diagnosed early, that their patients receive the appropriate surgery and then the appropriate treatment after surgery, which may include radioactive iodine ablation.
Wonderful. Thank you. For more information or an appointment at Peeples Cancer Institute, call 844-PCI-HOPE. This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.